Hi, do you ever get low back pain or know that you have problems at L5S1? If so, this is a strategy to help you decompress and alleviate some of that pain from L5S1. Welcome to the Body Shop Physical Therapy. I'm Dr. Catherine Price. I'm a physical therapist. In this video, I'm going to go over one strategy to help if you have pain coming from L5S1. Before I begin, I want to speak a word of life from Psalm 27:13. I will remain confident in this. I will see the goodness of the Lord in the land of the living. So a lot of problems come from L4, L5, and L5S1 in the low back. That is where there is most movement in the lumbar spine. And L5S1 can be compressed. Sometimes it's a site where there are disc herniations or compression where the transition between the very bottom vertebra of the back is going to sometimes move forward, so to speak, over the sacrum, and that can be a spondylolisthesis, which can further compress that joint in the back, or you can just have that decrease in degenerative changes that happen where then those joints, so if my hands are the joints and they overlap, if they touch, that those they're called facets. They're bony prominences off of the vertebrae, and they have a high nerve supply, and it can be really painful. So if you've got compression in your back or you've got some problems in L5S1, then you can get pain that kind of goes across the belt line or in the low back. And there is one thing that I like to do to help with just decompressing that area. Of course, you want to consult your healthcare provider to make sure that this intervention or strategy is appropriate for you and your particular problem. So it's really simple. I'll use a foam roller, and I'm going to then put a pillow over top of that. You don't have to put a pillow over top of it, but it's more comfortable, I think, if you do. And what you can do is you're just going to take the very front of your hips and you're going to press them on the roller by just lying flat across, and you just want to rest down over top of that. When you are doing that, it is going to help open up L5S1, and it should feel good to the low back. If it's painful, then it is not the right exercise. And you can hang out here until you feel that pain subside. And that's just one strategy to help with decompression and getting out of that low back pain that comes on due to the irritation at L5S1. And that is it. I hope this helps, and have a blessed day. Thank you.